we will talk about airway obstruction due to a foreign body. So the one thing that's really important is a child with partial airway obstruction due to a foreign body will cough spontaneously because the cough receptor will be activated. So uh, in this case, no, if the child is conscious and he or she is actually coughing, so no intervention is indicated. An intervention is only indicated if there is no the patient is no more able to cough, fall unconscious, or in respiratory distress or stridor increase. So let's say if the child become unconscious, or if he is unable to cough effectively, or in respiratory distress, then what we do, the very first step to do is that we try to open the airway for him. So let's say if it's unconscious and lying, uh, and he is so we try to open the airway with a head tilt, such as we place one hand on the forehead to just extend the neck a bit, and with the index finger of the other hand we try to lift the chin. So this helps to open the airway. Now, in the second step, we inspect the oral cavity for foreign body. So, if it is seen or visualized, we with a finger sweep or with a suction, we can remove uh, the foreign body. No blind suction or finger sweep is recommended because it could further push down the foreign body, and a partial airway obstruction could actually be turned into a complete airway obstruction. So this is not recommended, and most of the time we give these children some of the grandmother or somebody has not only caused trauma due to the blind sweep of the finger, but actually cause a further push down of the foreign body. Third step is that, let's say the patient is not breathing. So uh, and one thing you should remember that if the patient is not breathing and lying unconscious, so you have to go through the CPR pathway, and so mouth to mouth breathing, and you have to look for the chest rise uh, for effective ventilation. Uh, if you see that this is effective ventilation, so you will continue with the uh, with the with the ventilation until help arrive. Now, if you see this unsuccessful ventilation in some way, so we try to reposition the event the same way and try again. If it is still unsuccessful, so then we try to uh, do the maneuvers. So let's say, for example, if the baby is less than 1 year, the child is less than 1 year, so 5 back blows and 5 chest thrusts are given, and after every cycle we inspect the child mouth for foreign body, and if it is seen, then we try to remove in the same manner I discussed earlier. For instance, if the child is more than 1 year of age, so we do Heimlich maneuver, and if the child is able to stand or sit, then we do in from the back side, we give this uh, abdominal thrust from back, supporting the child. And if he lies on unconscious, then what do we do? Abdominal thrust just below the ZP sternum, and we push the abdomen up. These abdominal thrusts are given from different. Similarly, the basic thing is, if you have to go for, if the child is unconscious, not breathing, you have to go, are unable to breathe, then you have to go the CPR pathway. Otherwise, the Heimlich maneuver and back and chest compression and back blows and chest thrusts are recommended in different age groups. So this is a kind of short video, and uh, most of the time in IMM exam in Pakistan, usually we get a station on this, so maybe it may be a bit of helpful. Thank you.